Hi, and welcome to Heal Thyself. We're going to have a discussion today about pain and inflammation. My business is Barty Harmonics, and I started my business to help other people. I've found so many people suffering from pain and inflammation in my practice, and so many ways and means that they have tried to help themselves. We're going to talk about some of those things, the bodily systems that are contained in pain management, what works and what hasn't been working, and how you can take control of all of these things and help yourself. Frequency medicine, quantum physics and quantum mechanics, frequencies, and all of the major bodily systems are going to be discussed today. And just a call out that next week we'll be talking about the vagus nerve and vagus nerve stimulation. Here are the body harmonics modalities that we currently practice. You'll notice that it's not only frequency medicine, but touch therapies, different kinds of supplements, elixirs, water, and what water can carry and consume into your body. What we do is we provide assessment, we do research, and then we provide a measured application. And then while we're going through therapies, we provide biofeedback and making sure that it's working. I'm Lily Woods, and my education in the medical practice to date, over the years I've been in, has shown me that so many times the medical system and conventional medicine fails to go cross-system wide and go deep enough to actually understand why people are in pain and why inflammation occurs and how we can manage chronic issues. My mission is to bring this education to the public. My education is involved with 2 masters and 2 PhDs in business, in psychological assessment and neuropsychology, in quantum and theoretical physics and neuroscience. All of these modalities have helped me to learn that cross-science and poly-science modalities really do help us to try to explore these subjects. So let's get going on to our topic. Pain and inflammation. So many people experience unresolved pain and discomfort. They see their doctors, they follow up, they take medication, they try to find something else to use, they go through a procedure, they have a surgery, and everything just seems to build up. And sometimes you get relief and move on with your life, but other times it becomes chronic and you can't figure out where to turn and you're suffering and it impacts your daily life. How can you handle those responses more systemically? I believe it's through education. That's helped me, and it's helped me in my practice. And my mission right now is to make sure that that education is in your hands so that you can start healing yourself. So the first thing we're going to start talking about is energy as it's described by physics. The general scientific definition of energy is the ability to produce action or effect. So why do we care about that in the body? Energy is movement. When energy moves, it creates a compression wave. Think about a boat going through the water, and you can see the waves created on either side. And one side is a positive wave, and the other side is a negative effect. And some of those things and those polarities happen in almost every single energetic interaction that we see. Frequencies are amplitude and wavelength. And all of these energies are also transported in our body. Our bodies are constantly in a state of resonance and vibration. When you walk down the street, your body's constantly exposed to different energies, and you consume both the positive and the negative. Waves are all around us, and our body structures are incredible mechanisms for processing these. We want to be sure that they're processing the right things. So let's talk more about what happens with the body's processing of these. Another concept in physics that we're going to talk about now is resonance and frequency. This is where resonance is where the natural frequency of a medium vibrates at its highest amplitude. The highest amplitudes are usually more positive and usually more healthy, but that's not always the case. A disease state really is produced by a lower frequency for that organ or tissue, and that's been known through many different studies. There is one prime resonant frequency that's observed for the healthy organs and how the healthy organ vibrates, and we're going to talk a lot about those frequencies and tones. This quote is very, very important. Everything in life is a vibration, and that was from Albert Einstein. And Tesla also said that everything is a vibration, and frequency was the next science of medicine. So let's talk more about frequency, its medium, and vibration. If you look at quantum physics again, you'll see that everything happens at an atomic and cellular level. When you look at this prism picture that I have right here, you can see that a prism diffracts white visible light. The visible components of light that we can see are then refracted into its colors, and every color has a different frequency. A shape can be defined by that, by the angle of how that's refracted. And all of those different patterns are something that our bodies know. It doesn't matter if it's a light or a sound or a shape that's giving us that frequency vibration. It's the same frequency vibration. And so there's a lot of different mechanisms we can use here from quantum physics in alternative medicine. So what are the quantum mechanics of the body? And how are our bodies working? And what are the major systems that are impacted within pain and inflammation? The central nervous system is one that's well known, well referred to in conventional medicine, and something that we're all pretty familiar with. It contains the brain, which is the processing center, and the spinal cord, which gathers up information from the different nerve branches and brings it back to the brain, and carries a lot of nerve, pain signals, etc., through our bodies, touch, etc. The traditional Chinese medicine meridians are also a very important system. It contains 12 major meridians that run on each side of the body, one side mirroring the other. And all of the meridians pass through all of the bodily organs, and some of them go from the feet all the way up into the cranium. Some of them go from the hands carrying through, but it touches almost all of the bodily areas. It's also something that we can pass frequencies through that are very healing. It understands them and can vibrate them up those pathways and provide a whole lot of value to the body. Another system we're going to talk about is called the lymphatic system. The lymphatic system is the cleaners. It goes through and absorbs all the dead tissues and inflammation and liquids in the body and passes them back into the circulatory system to be eliminated by the elimination structures of the body. And then also the vagus nerve. The vagus nerve is the biggest cranial nerve, and it has a posterior and an anterior component. And it also can be stimulated using the targus, and which we'll talk about in an upcoming slide. And some of the other areas of our body can also stimulate this vagus nerve and can provide a lot of frequency in a little bit different way to different structures of the body. So these five are we're going to be talking about in this presentation, and all five of these have different aspects to them and different ways we can use them for healing, but they're all involved in the process of pain and inflammation and also managing our body. So what about the frequency of the body and organs do we already know? As you can see here, these are depictions from two of the studies that are available out there, and there's numerous studies that show what areas of the body resonate what frequencies and what frequency patterns. And these frequency patterns and amplitudes and frequencies are known, and you can see from the oscillation patterns. If we know the frequencies of where we're trying to target, we can target with complex frequencies that reach those systems. And so this is a very important concept. On this slide, you can see also that this has been mapped through the different bodily structures in a way that we know what note. And so if we play a note on an instrument like a violin on an F, it resonates with the kidney. And the kidney is also at 84 hertz. So if we use an 84 hertz frequency, we can also reach the kidney. And if we have complex frequencies, we can reach multitudes of the systems that promotes a lot of healing. It's a very important concept to know what the frequencies are and how they can be used for alternative medicine practices. We also know the frequencies of light and the earth. And this is also equally important because it's not just sound that travels through the body, but light can be a healing force. And also, the interesting thing about light and sound and angle is that these frequencies can be delivered to the bodily systems. Another interesting point to consider here, and why I've included the earth features, is that as we're moving through any situation in our life and we come in contact with air and we move through water, or we're moving through an external force like going by a bus, that's all creating frequencies as we pass through. And some of them are positive, but some of them are toxic. And we have to be aware of what we're exposing our bodies to as we move through our systems. The electromagnetic spectrum is all of these elements, and it's what we're talking about at a minute level. This picture depicts all the different amplitude and frequencies for different structures that are not part of our body. And it's very, very important to understand these as you come in contact with them. It's a very well-known fact that electromagnetic stress is occurring right now from our cell phone use and electromagnetic waves from our appliances and in our homes, but it also occurs naturally in the earth. The earth has been impacted by the things that we're feeding into the earth with frequency patterns. So many factors impact our health. How do we weed through them and understand how to come up with a comprehensive plan? Education. So let's talk about some of the body's energy structures. The human body's meridians pass through, and this is the Chinese, traditional Chinese medicine view here. It's been reviewed and researched extensively, and you can see how they connect and they go through the different meridians. And these passages are the energy flows that go through the body. Each meridian is composed of 12 different principal meridians and goes through the organs, goes through 8 collaterals. And all of these systems are really important because you can use touch on acupressure points. You can deliver frequencies through the hands, the feet, the ears, the eyes, the vagus nerve. All of these things reach those frequencies and can be delivered to many different points of the body. So this meridian system is a delivery mechanism, but it also communicates with the brain and our systems. So if there's pain happening in the body, this system will be delivering it where it needs to be delivered for understanding. So having a crystalline structure in our electromagnetic body is not a widely known concept, and I think it's very, very important that the general public knows about this. Some of the human body structures are built with crystals, and they're in crystal patterns and lattices. These crystalline structures balance, communicate, and generate any energy within our bodies. They resonate at frequencies and they vibrate. But because they're lattice structures and they're crystals, they can harden or become damaged with injury, age, surgical procedures, or many other things. If they become hardened, they cause pain and inflammation. This is often missed as a treatment area of conventional medicine. Some treatments involve myofascial release and touch and massage, but other treatments are frequencies where we're delivering frequencies to these structures to help them remember how to build and design the cells more appropriately. Crystalline structures that are damaged need to be rebuilt. They don't just repair naturally. They need to remove the damaged tissue cells, are the cells that in those crystal lattices, and move them out of the body and repair them with new structures. So the lymphatic system is part of the body that does all of this elimination. The lymphatic system is very, very interesting because it works with the normal circulatory system of the body, which means the blood vessel system. And it slips in between every single one of our cells, but it has some major processing organs, as you'll see depicted here. When our lymphatic system is blocked, it causes pain and swelling to occur because that elimination is not happening. A major consideration in the lymphatic system is that it doesn't have a pump. This means that if our body's not moving, if we are in a state that we're not able to move effectively, or we're laying flat for long periods of time, or possibly something was injured and it's blocking the movement through a joint or a tissue area, we have to get it back moving. How do we do that? We can do that with touch therapies like lymphatic drainage and massage, which is critically important. We can do it by applying frequencies to those areas and moving that frequency and vibration in, which also gets it moving because it's doing a mini pumping to that area. If you've got swelling and they keep saying, oh, we don't know why, this could be a very important thing for you to look into. So let's talk a little bit more about the central nervous system. The central nervous system is the nerve structure through the body, and it is fed from the spinal cord through the different areas of the body, and it goes back up into the brain for processing. This is how a lot of pain is communicated to the brain. This structure is impacted by medications, as we all know. We can take ibuprofen and it alleviates or deadens those nerve signals to the brain. It doesn't fix it though, it just deadens it. And a lot of medications that are served through the body nowadays do just deaden the pain. They don't fix the symptoms. So the pain and why the pain is occurring is critical to find out. And how to heal the areas of the body that are producing that pain is critical to find out. How do we do that? Another important aspect that's not systemic, but is highly important to understanding bodily deficiencies is how our body is using and processing mitochondria. Mitochondria exists at the cellular level in our bodies, and this structure needs to occur because it provides the fuel to every single one of our cells. The fuel that it creates is called adenosine triphosphate, and that actually feeds what the cells need to regenerate. The cells need that energy and fuel so that they can appropriately follow the designs in the DNA to promote these structures. Many different systems, whether it's toxicity in our body or certain medications or things that our body is not functionally, producing well enough. Maybe we don't have enough iron, or, we're not drinking enough water, or we're not eating the right foods. All impacts how our mitochondria could develop, which means that if our cells can't produce the right fuel, our immune system is weakened. We might have chronic fatigue. It definitely plays a role in dementia, some other systems. And it's an important thing to consider when you're considering your health is how am I functioning at the biological level? Because that's also impacting my experience of pain and inflammation. And the final thing we're going to talk about today is the vagus nerve. The vagus nerve is the largest cranial nerve. And a lot of people don't know about the vagus nerve, but as you can see how it's depicted here by John Stuart Reid, there's a posterior and anterior component that touches almost every major organ in our system. Therefore, by properly stimulating and giving the right frequencies through this nerve, it allows those frequencies to retune into that primary resonant frequency that we spoke about earlier. This happens through a regulation process, and each one of these components of the vagus nerve can be bidirectional. It can also promote healing in each one of these organs, and the stimulation across the whole bodily area is critically important. We'll be talking more about the vagus nerve in my upcoming presentation next week, where we're digging more into it and how we can leverage that. So in summary, what have we learned today? Pain and inflammation is not just isolated to one section of our body that might be experiencing it. It really means that there's systemically something wrong. And pinpointing that is a very complex process in our human body that even conventional medicine does not completely understand. We are all responsible to understand how our body functions to make sure that we can heal ourselves. In the system right now that's scattered, medical information isn't commonly available. Standards of care in medicine right now are really streamlining the different types of diagnoses and what can happen in terms of a prescription or prescribing procedure for those are all controlled by insurance companies now. So we have to take control of our medical knowledge and make sure that we are expanding that to every kind of therapy that can help us. I'm Lily Woods, and I'm thanking you for attending my presentation today. And stay tuned next week when we discuss the vagus nerve and every way that we can stimulate that for our benefit. I want to also talk about the frequency medicine modalities that Body Harmonics supports. It's not only frequencies, but touch therapies in a comprehensive way that's built from an assessment that we do individually for you. Thank you so much for your time, and I look forward to seeing you next week.